November is American Diabetes Month. I'm with CU Medicine internal medicine provider Dr. David Tanaka, and I wanted to get some general information about diabetes, how to know your risk, any prevention measures you can do. Most people probably think they know what diabetes is, but can you briefly explain what it is and touch on the different types?
Certainly. So the vast majority of adult patients who develop diabetes have what's known as type 2 diabetes, and that's not a problem with insulin production per se. It's mainly a problem of insulin resistance. The majority of adult patients don't have a lack of insulin. They have a problem with the insulin that their pancreas is making not being as effective and allowing their sugar in the blood to be too high. One of the symptoms of early diabetes is what we call polydipsia and polyuria. So what that basically means is polydipsia is increased thirst and increased drinking, and polyuria is the increased urination because of the sugar in the urine. So anyone that has increased thirst and increased urination should see a physician to have blood testing. The other things that happen is that when your sugar is high, your body isn't able to utilize the glucose as well, and people feel tired. You've got all this sugar, but your body can't utilize it, and it just doesn't work as well. It also causes the lenses in your eyes not to really focus very well. And so intermittent blurred vision is another sign of high sugars. The other type of diabetes is called type 1 diabetes, and that typically is a diagnosis that's earlier in life. And unfortunately, that's when the pancreas stops making insulin, and we need to treat that with insulin. The treatment of type 2 diabetes is to try to get the insulin that your pancreas is making to work better.
As you mentioned, type 2 diabetes accounts for most diabetes cases, at least in older adults, that they develop later in life. Who is at risk, and how can someone find out if they are at risk of developing type 2 diabetes?
So the main risk factor for type 2 diabetes is obesity, and it's really the increased fat around the abdomen increases the insulin resistance and increases their risk of diabetes. The other major risk factor is if there's a strong family history. So if everyone in your family has diabetes, even if you're not obese, unfortunately, you're probably at higher risk for developing diabetes.
Even if you have that family history, what are some ways people can prevent or reduce their risk of type 2 diabetes?
What we know is that a doable intervention actually can significantly decrease your risk of developing diabetes. So that's something that I really try to emphasize to my patients, that if they walk for 30 minutes, 5 days a week, and if they lose a little bit of weight, they can decrease their risk of developing diabetes by more than half.